Welcome to our podcast with Kate McLaren, who is a consultant at Chelsea and Westminster Hospital and specialising in fertility. That's a very topical subject, isn't it? Kate, do you want to thank you so much for coming along today?
Oh, thanks for inviting me. I'm really pleased to be here.
Can you just share the early years of Kate and how you got into medicine, into medical school in the first place?
Yeah, absolutely. I mean, I grew up in Northern Ireland, and my family wasn't medical at all. You know, my mum hated the sight of blood and everything, but I loved science, particularly biology, and I can remember sort of umming and ahhing between going to vet school or medical school, and thank God I chose medical school. I'm pretty glad of that now. And then after medical school, when you rotate around all the different specialties, and I really loved obs and gynae, and I'm just so glad I ended up finding my niche in sort of fertility world, because I think that I really loved talking to people, helping them through really, really difficult journeys often, and it's such a great field to be in.
But you kind of, what age did you work out all that? This is because you're expected to make really difficult decisions.
It's really crazy. It's about
you don't really know much about.
Yeah, at 16, you're having to make these big A-level decisions, and that's all tailored. And particularly, medical school now is so competitive, and people need to be building that CV from kind of quite early stages now. Yeah. But so I probably knew by 16. But I mean, I have to say, I wasn't like I was 100% sure, but I think then, you go through medical school, and it's, such an incredible experience.
Which, interestingly, when I was younger, you needed higher grades to get into veterinary medicine than you did into medicine.
Yeah, and weirdly, well, I went to Edinburgh. I think the vet school, it was a longer course than medicine as well, which is strange. Worrying.
Well, I suppose one of my favourite programmes is All Creatures Great and Small.
Love that.
I love that. So the books, and that's, I think, because we never really had pets and stuff as a child, but still want to be in there.
Yeah. I think it was probably quite a common, decision with medics. I guess it's the helping people or helping the animals, isn't it? But glad I've got humans at the end of my consultation.
And then, so when you were in university, what was it that attracted you to obs and gynae?
I think actually I wasn't 100% sure on that when I left medical school, but that's the nice thing, I guess, about those early years when you're rotating around everywhere.
Yeah.
But then so I did my sort of early rotations, did sort of 6 months in obs and gynae. And I just love the fact it's this massive field, obs and gynae. So, you can be running around delivering babies, seeing people in antenatal clinic, or you can be doing major gynecological surgery for cancer patients, or then what I do, running around an IVF unit, doing egg collections and things. So I think obs and gynae is so good, because no matter what your personality or what your skill set is, you can find your area to go into.
Because it is one of the specialties which has a significant amount of medical stuff and surgical stuff, isn't it? And that's quite unusual.
Yeah, exactly. So it's so varied. So you just never get bored every day. Genuinely, it sounds cliched, but every day you can be doing different things, and that's so satisfying, because at the end of the day, hopefully this is a really long career we're going to be in. So you need to keep it varied and keep your interest.
Do you cope with, I remember labour wards when I only did 3 months of it. So I did 3 months. Normally in general practice, you do rotation, and then I did 3 months of labour and 3 months of gynecology. Oh my God, it was the most stressful time, I think, ever.
Yeah.
It's making quick decisions, and there's lots of uncertainty, and you kind of clinic. How did you cope with that?
Yeah, it's so funny, isn't it? Because looking back on it now, I sort of think, goodness, I mean, it's a pressure for doctors on that. And, I think junior doctors are much better supported than perhaps when we were, on the wards in those days. But there's also the adrenaline, and part of me did love it, and I because it is, but the highs and lows are both really, really extreme. But I think, it's amazing what you can train your mind and your body to do in those moments of panic. And it's hugely beneficial, because, that skill that you've learned to stay calm under pressure, no matter what's going on. It was incredible. And I definitely don't regret those years, but at the same time, I'm definitely not an adrenaline junkie. that life wasn't for me. And so that's why I was able to stop obstetrics when I got my consultant job and just focus more on sort of hormones, fertility, the gynae.
So you've kind of gone upstream.
Yeah, exactly.
So fertility, or is it fertility or infertility?
Well, I prefer calling it fertility, or maybe even subfertility, but infertility is a bit sort of final, isn't it? Definite. I don't really like that.
Well, it's also a negative word, and it's something that, so fertility, I think, is the word to
prefer that. Or even reproductive health, because I think
a bit fancy. That's a bit. But
I think the problem I think sometimes we're so focused on just like the fertility part of it, you forget about the whole patient and the more the holistic side of it. So, but I agree. Let's stick with fertility. I'm happy with that.
Again, that's a really stressful area, isn't it? Has there been a rise in people are choosing to have families later in life?
Exactly. So we've seen that hugely over the last sort of 30, 40 years. The average age that women are having their first child has been massively increasing. And I think it's due to quite a lot of factors. So, people used to, women often weren't working and also, didn't know so much about contraception and things. So much more use of contraception. People, women having careers now. There's also they've done lots of surveys on this. And, it's not just that women are being selfish and delaying childbirth. They also aren't in relationships and, until later on. So, there's been a massive change. And funnily enough, we were looking at our sort of the average age of our patients at the Chelsea and Westminster Fertility Unit recently. And 40 to 42 is our biggest group of women having IVF treatment.
Really?
Rather than, everyone thinks it's the under 30 Philips, but it's not. And so, we see a cohort, and that just, I think there's so many misconceptions. Because a lot of people, I think, don't really, they understand the impact of age on fertility rates, but maybe not to the full extent that it really does impact it. So, I think age, that's been the biggest change in the fertility kind of.
Well, can I ask actually, obviously there is this referral criteria that we get in primary care. One of them is age, and the cutoff for NHS referrals is 42. And it'd be really helpful to get your views on why it's 42 and not 41 or 43, because there are complications associated with that.
Yeah, absolutely. I mean, look, if you're 40, your chances of getting pregnant each month is about 5%. If you're 45, that's 1%. Right. And that sort of aligns similarly with IVF success rates. They're, maybe 20 to 25% at 40. By 45%, it's almost as close, definitely less than 5%. So I think at the end of the day, the decision to make it 42, which I'm not blaming that I was involved in that in any way, but it's just because the chances of pregnancy beyond that age are quite slim. And I guess that's where the ICB, the Health Authority, has set those criteria. But we are, and I don't want to rant on about this too long, but we are in this awful situation of the postcode lottery for fertility. And that's, so you do see different parameters between the different ICBs.
Yeah. And I suppose there's not much that we can do, as clinicians. We can feed into that process. Yeah. We don't control it.
Yeah, exactly. But that, just to kind of reassure people, that's what we are fighting really hard for in the fertility units, to, particularly around Northwest London, to make that more equitable to the other areas in London and things. So we can always do better.
See patients, there's quite high levels of anxiety, aren't there?
Yeah, definitely. And I think, often by the time that they, see us at the sort of tertiary level in the fertility clinic, they will have been trying for a really long time. And I think as well, it's really easy as clinicians to sort of sometimes get complacent and say, oh, it's only a year, it's only 2 years. But that's month on month having a negative test or a period coming. And that's devastating. It's really, really hard for patients. And so I'm never too judgmental about the length of time, because I think it's really kind of patient or couple specific how it's affecting them. But I think, look, levels of stress can be really high. And I think it's so important for people to look after themselves when they're going through this kind of journey, because I'm not a massive believer. I don't like it when people are saying, "Oh, stress, that's why you're not getting pregnant." You hear all these awful things, don't you? People saying, "Just stop trying, relax, and you'll get pregnant immediately." You know, come on. But it's about this. It's a tough journey if whether it's taking a long time to conceive or whether you're going through the fertility treatment. So you've got to look after yourself to get your resilience levels up for the the things that are to come.
What is the answer? Do you think is it because it's hard because at that point in time that's all you think about.
Yeah.
And it's quite hard to shake that off, isn't it?
I think the first thing is that we need better information out there for patients. There's all this misinformation on all the social media sites that are winding people up. There's also this huge kind of commercial element to it all where, everyone on social media is trying to sell you a vitamin that's going to get you pregnant or some device that's going to help. And that feeds all this anxiety. So I think we need much better patient information. And I think people do need better access to fertility services early. And also, to get that accurate counselling to say, okay, this is when you should be worried. You're lovely and young, you've got good egg reserve. Don't worry about this now. Or no, you've got factors that make you more at risk for delaying conceiving. We need to see you sooner. So I think starting with the information and then just empowering women and couples. Don't want to forget about the men or couples and just to get them better psychological support during it.
Because we find actually that couples, because we in primary care we do some basic investigations, some tests, and for men and women, and it's really this conversation always sort of turns up. But people say, "Oh, is it my fault, or is it? Oh, who's?"
Yeah.
And actually, how do you approach that?
What's interesting, isn't it? Fertility, it's so woman-centered in a way, isn't it? She's the one who gets referred, by the GP, and I slightly the blame lies in the amazing kind of development that was ICSI. So this is where we can overcome, to some extent, male factor. Yeah, so this is where we can, in some ways, overcome male factor. So it's a form of fertilizing the sperm, and we pick the sperm and inject it into the egg. And so once we were able to start doing that, everyone sort of forgot about the man and thought, oh, this doesn't matter. But I think we're realizing now, 20, 30 years on, that still the sperm plays a huge part. And so absolutely, when I'm seeing a couple, I will take the woman's history. I will then take the man's history. And the problem is with the men, we're still, the basic test is just the semen analysis, and so they're not looked into that much. And again, I think at a much earlier level, when you're trying to conceive, it's also really important to optimize the sperm as much as possible. And I think there's been quite a lot of development in the last few years about extra ways of looking at sperm, sort of more in-depth analysis that might be relevant for some people going through IVF and other fertility treatments. So we are looking, I think male factor luckily is having a bit of a heyday at the moment. There's a lot more awareness about it. You've had some celebrities come out and really promote it and things. So I think the men are being sort of, hopefully looked into a little bit more. But it's important for people to push their specialists if they do think that they're being ignored, definitely.
What things can help sperm then?
Yeah. I mean, so diet and lifestyle is, I know it's all the, the sort of cliche things, but, really, so sperm, first of all, they take 3 months to form, the life cycle of a sperm. So any changes are going to take a good few months to kick in. But really optimizing diet, so plenty of antioxidants, so like the fresh fruit and vegetables, the balanced diet, not smoking. Smoking's, we know that's not great for sperm. You need to reduce alcohol, but just within the recommended limits. And sperm don't like testicular heat. So sitting for too long, laptops on the lap.
Just uncross your legs.
Loads of long distance cycling, things like that are not great for sperm health. But mostly it's just trying to be as healthy as you can. And I always say to people, look, you don't need to, it doesn't have to be, 24/7 that you're doing everything perfectly. You're allowed to relax sometimes, but it's just really trying to eat and drink and live as healthy as you can. And that's going to really help the sperm.
But I think it's important because if I suppose the similar sort of advice applies to women too, but there's some specific things. But actually, if the couple do it together, then it's sort of nicer, isn't it?
Exactly, joint approach. I mean, because that's the thing. Actually, having fertility difficulties puts a lot of strain on the couple. And so finding ways like that you can both be, going out and whatever that exercise is can really help.
Cooking meals together,
supporting each other.
Rather than but what can women do to improve their health? Fertility.
So I think with the women, so similar like lifestyle and diet, definitely like really eating well, smoking, reducing caffeine as well is quite important just in terms of miscarriage risk and so on. And optimizing your weight as well. And also I think really important, folic acid as well. So obviously you need the pre-pregnancy supplements, folic acid, vitamin D.
Okay.
And also I think it's a really important sort of opportunity, even before someone's thinking of having a baby, optimizing any other health conditions. So like thyroid, diabetes, weight, all these kind of things, just to make sure that you're in the best health for pregnancy as well.
Okay.
The big one with women is their periods. So if you're having regular periods, you're probably ovulating regularly. And then it's just, but it's like monitoring that kind of thing and just having a bit of awareness. And then the advice is just to have sex every couple of days through that sort of fertile time.
Ovulation kits, do they work or not?
I feel that they're definitely a double-edged sword. There has been a bit of evidence actually recently that couples did seem to have slightly higher rates of conception, but I don't know, in reality I find they can add a lot of stress and pressure, particularly on the man's side as well. You will perform now. It's not a great kind of libido booster.
Overwhelming, can be.
So normally what I say to patients, look, if you want to do them for a month and just have that confidence that you ovulate, it's fine. But then I say just go and have sex every couple of days, and that's
because a lot of people are geographically apart, aren't they, these days? There's lots of social and demographic stuff is big contributing factors to.
Absolutely. People are traveling all over the place for work now. And so I think that those are situations where maybe it is helpful to know when you're ovulating. Yeah. But if you have a regular cycle, you can be pretty confident you know anyway. But if you have a bit of cycle irregularity, then maybe they are a little bit more helpful. But again, it's just trying to balance that stress factor.
Yeah. Well, easier said than done.
Exactly.
But actually, kind of maybe not focusing on fertility and focusing on whether it is an activity or a sport or focusing on that and like yoga or meditation, something where your mind is completely occupied. Is probably the best to.
Yeah, exactly. Just doing, or I suppose everyone's different, are they? What they find relaxing, but you just have to find whatever works for you. For some people, that'll be going out and doing a run. For some people, it'll be meditating, and exactly, or just spending time with family or whatever. But again, that could be stressful too, depending on your family. But
I don't want to spend time with my family.
Just finding what works for you, and just giving yourself that permission to be like, I'm going through a bit of a tough time. It's okay. I can say no to things. I don't have to go to someone's baby shower if that's a real trigger, and you just be allowing it's okay. You can, take a bit of time to yourself for this period of your life. And,
So a day in the life of a consultant, folks working in fertility, how many babies do you think you've brought?
My goodness. I sort of wonder, it's got to be, I don't know. It's a good few hundred, I'm sure. It's, it depends what you call my work, but my favorite thing to do is the embryo transfers, IVF. So that's the kind of end point of the fertility treatment, and that's when we have hopefully have a beautiful embryo in the lab. And our embryologists, the lab team, are amazing. They're the real stars behind this process rather than the consultants. But so the woman will come for her embryo transfer, and essentially what we do is do a scan of their tummy so I can see what we're doing to look at the womb. And then we put a little tube in through the neck of the womb and the cervix into the womb cavity, and you just inject in the embryo in a little bit of fluid and pop it back in nicely. And that's my favorite.
Steady hand.
Very steady hand, yeah.
And how many of those did you do
definitely do several. It was maybe 3 to 5 in a day. Yeah. So normally, if you're covering the assisted conception unit, whereas sort of the IVF unit, you'd be doing egg collections in the mornings, and that's
what does that mean?
Yeah. So that's we do that through the vagina as well. But I'm sure most people have at some point or seen at one of those internal scans that we do, the transvaginal scans, we have a little needle on the end of that goes through the vagina into the ovaries. And by that point, the ovaries should be really nice and big and full of juicy follicles. So we suck out the fluid that's in those follicles. And then again, that fluid's taken to the lab where they look at it under a microscope. And then they'll shout to me, egg, if there's been an egg found in that. So we get immediate.
It's like a little treasure hunt.
Yeah, that's right. That's
how many eggs would you grow up with?
That depends on the woman's egg reserve. So you hope for maybe between 8 to 12 or more a cycle. But unfortunately, for some people, if their egg reserve has gone down earlier in life, or particularly women in their late 30s or early 40s, you're often not going to get that many eggs.
Well, thank you so much for coming along today.
It's a pleasure.
I suppose we ought to finish by saying your top tips for getting pregnant. Three top tips.
Oh my goodness.
For fertility.
I guess it goes back again, and I know it's boring, but it's just optimizing your lifestyle and diet. That is honestly so, so important to get your egg and the sperm quality, really good. And I think the other thing is, you don't have to suffer this alone. There's so many good resources out there, like Fertility Network UK is this amazing charity. And, I think there is a huge amount of societal family pressure on people to get pregnant quickly. And, I think for women, don't feel that pressure. If you can't, get help out there. Go and see a fertility specialist, if you're worried, or speak to your GP, and the GPs will be hugely reassuring. And then third tip, what should I make my third tip? Don't listen to social media. Yes, get proper advice from evidence-based, resources. There's an awful lot of nonsense out there, I'm afraid, that people have to wade through and take it all with a pinch of salt.
I think that's why we're doing this, stuff like this, actually, to kind of counteract that. Thank you so much. You've been an absolutely amazing guest.
It's been really, really, really interesting.
Thank you.